It started as a routine visit, just another day in the doctor's office, but no one expected the tension that would soon unfold. The patient, a middle-aged man named Mark, walked in with a clear problem, a sharp pain in his side that had been bothering him for weeks. He was desperate for relief, but the moment he learned something about his doctor, everything changed. Dr. Reynolds, a seasoned physician with years of experience, entered the room, ready to help. With a calm and professional demeanor, he introduced himself and began reviewing Mark's symptoms. But before the exam could even begin, Mark noticed something on the doctor's desk, a small political pin, barely noticeable. It was a Trump campaign button from years ago, tucked near some medical papers. That's when Mark's expression shifted. His discomfort wasn't just from his physical pain anymore. "Wait, you support Trump?" Mark's voice was sharp, filled with disbelief. His posture stiffened as he sat up straighter on the examination table. Dr. Reynolds looked up, taken aback by the sudden shift in tone. "I have my personal views, yes," the doctor admitted, keeping his voice even. "But I'm here as your physician, not as a politician." Mark shook his head. "I can't believe this. I don't want treatment from someone who supports ***. His words were firm, his anger building. The air in the room grew thick with tension. A painful dilemma was unfolding, not just about politics but about trust, about whether personal beliefs should interfere with professional care. Dr. Reynolds took a slow breath, choosing his words carefully. "Mark, I understand your feelings, but right now, my only focus is your health. Can we put everything else aside for just a moment?" Mark hesitated. His body screamed for relief, but his mind wrestled with his convictions. Should he let his personal beliefs dictate his medical care, or was there something more important at stake? What happened next? No one in that room saw coming. Mark's jaw was clenched tight. He had walked into this office expecting nothing more than a routine checkup, but now everything felt different. His pain was real, but so was his anger. He had spent years feeling like people with opposing views couldn't be trusted, and now here he was, sitting face to face with one of ***. Dr. Reynolds remained calm, though he could sense Mark's frustration growing. This wasn't the first time politics had come up in his office, but never this directly. Most patients didn't ask. Most didn't care. But Mark cared, a lot. "You don't get it," Mark muttered, rubbing his temples. "People like you. You're the reason things are the way they are." His words were laced with resentment, but there was something else beneath them, something deeper, something personal. Dr. Reynolds folded his arms, studying his patient for a moment. "Mark, I'm not here to debate with you. I took an oath to help people, no matter who they are or what they believe." Mark let out a dry laugh. "That's easy for you to say. You're not the one who has to deal with." He stopped himself, his expression darkening. His fingers twitched against the examination table. Dr. Reynolds noticed the hesitation. He had seen this kind of reaction before, when someone had something weighing on them, something bigger than what they were saying out loud. Maybe this wasn't just about politics. Maybe there was something more. "You're obviously upset," the doctor said gently. "And I get the feeling this isn't just about me." Mark's eyes flickered with something, hesitation, maybe even guilt. But just as quickly, he masked it with frustration. "You wouldn't understand." Dr. Reynolds didn't push. He had learned over the years that people opened up on their own time. But one thing was clear. This wasn't just a patient refusing treatment. Something else was going on, something Mark wasn't saying. And whatever it wasn't over yet. Mark shifted uncomfortably on the examination table, his body tense, his mind racing. The pain in his side was sharp, but it wasn't the only thing eating at him. His emotions were tangled, twisted between frustration, pride, and something he didn't want to admit: uncertainty. Dr. Reynolds kept his expression neutral, but he could feel the weight of the moment. He had seen stubborn patients before, ones who let their emotions get in the way of their health. But this felt different. Mark wasn't just angry, he was struggling with something deeper. "I don't know what you've been through," the doctor said finally, breaking the silence. But I do know that pain has a way of making everything feel worse. Physical pain, emotional pain, they feed off each other. Mark scoffed. Yeah, is that your professional opinion? He crossed his arms, but there was no real bite in his words. It was just a defense, a shield. Dr. Reynolds sighed. My professional opinion is that whatever's going on with you, it's more than just politics. And if you'd any help, we could at least start figuring out what's wrong. Mark stared at him, his jaw tightening. He wanted to walk out, wanted to prove that he didn't need help from someone like Kim. But then another wave of pain shot through his side, sharp and unrelenting. He winced, gripping the edge of the table. Dr. Reynolds noticed. That's not something you can just ignore, he said, his voice steady but firm. I know you don't like me. You don't have to. But if you leave this untreated, things could get worse. Mark swallowed hard. His pride told him to push back, to stand his ground. But something else, something buried deep, whispered that maybe, just maybe, this wasn't the fight he should be picking. The room was silent, the air thick with tension. Then, just as Mark opened his mouth to speak, the door creaked open. A nurse stepped in, holding a chart. Doctor, there's something you need to see. It's urgent. Dr. Reynolds glanced at her, then back at Mark. The patient's face had changed, his frustration now mixed with something else. A flicker of fear. Something was wrong, and they were about to find out what. Dr. Reynolds took the chart from the nurse, his eyes scanning the page. His face didn't change, but Mark noticed a slight shift, something subtle, something unsettling. The doctor's fingers tightened around the paper before he looked up, meeting Mark's gaze. Mark, he said carefully, we need to run some tests. Right now. Mark tensed. What? Why? Dr. Reynolds hesitated, choosing his words. Your symptoms, they might be more serious than we thought. Mark let out a breath, shaking his head. Come on, you're just trying to get me to stay. His voice was sharp, but there was something else in it now. Uncertainty, maybe even fear. Dr. Reynolds didn't argue. He simply set the chart down and folded his arms. You're free to leave. I won't stop you. But if you do, you need to know the risk you're taking. Mark clenched his jaw. You don't get to scare me into trusting you. The doctor exhaled, keeping his voice steady. This isn't about trust. It's about facts. I've seen cases like yours before, and if I'm right, waiting could be dangerous. Mark wanted to argue. He wanted to tell this man that he didn't care, that he would rather walk out in pain than accept help from someone whose beliefs disgusted him. But then, another sharp wave of pain shot through him, stealing the air from his lungs. He gritted his teeth, gripping the table as his body tensed. Dr. Reynolds stepped forward instinctively, but Mark held up a hand. I'm fine, he grunted. The doctor didn't move back. You're not. Mark's breathing was uneven. He felt dizzy, his vision swimming for a moment before clearing. He had been so caught up in his anger that he hadn't wanted to see the truth. But now he was scared. The nurse shifted by the door, glancing between them. Doctor, should I prep the room? Dr. Reynolds didn't look away from Mark. That's up to him. Mark's fingers twitched against his knee. His heart pounded. He didn't want this choice. But he had to make one, and fast. Mark's pulse pounded in his ears. His pride screamed at him to walk out, but his body was failing him. The pain was unbearable now, radiating from his side like fire. His breathing was shallow, and his vision blurred for a moment before snapping back into focus. He wasn't okay, he knew it. And the worst part, Dr. Reynolds knew it too. The doctor stayed where he was, waiting. He wasn't pressuring Mark, wasn't forcing him to decide, but the weight of the moment was crushing. Mark swallowed hard, his throat dry. His entire life, he had drawn a line between people like himself and people like Kim. But in this room, in this moment, none of that mattered. It was just one man in pain and another man trying to save him. Finally, Mark exhaled sharply. Fine, he muttered. Do whatever tests you need to do." The nurse moved quickly, leaving the room to prepare. Dr. Reynolds didn't waste time, stepping forward to check Mark's vitals. His hands were steady, his focus sharp. There was no "I told you so," no smugness, just a doctor doing his job. Minutes later, they were in an exam room, the hum of medical equipment filling the air. Dr. Reynolds worked fast, ordering scans, drawing blood, asking questions. Mark answered them between shallow breaths, his body barely holding together. Then came the results. Dr. Reynolds studied the screen, his face unreadable. Mark forced himself to sit up. "Just say it," he said, his voice tight. The doctor turned, his expression serious. "It's not what we thought." Mark's stomach dropped. "What does that mean?" Dr. Reynolds hesitated. "We need to admit you, immediately." Mark's skin went cold. The room felt smaller, the walls closing in. He had come in thinking this was a minor issue, just some stubborn pain. But now he wasn't sure if he was walking out of here at all. And the man he had almost refused to trust was the only one who could save him. Mark lay in the hospital bed, staring at the ceiling, his mind racing. The past few hours had been a blur. Doctors moving quickly, nurses checking machines, words like serious and immediate being thrown around. He had been so caught up in his own anger that he hadn't realized how close he was to real danger. If he had walked out of that office, if he had let his pride win, he might not have made it. Dr. Reynolds stepped into the room, his expression calm but firm. "We caught it in time," he said. "You're going to be okay." Mark let out a slow breath. Relief washed over him, but so did something else, something harder to face. He had judged this man, dismissed him, refused to trust him over something that, in the end, didn't matter. Dr. Reynolds had never treated him differently, never let their differences get in the way of doing his job. Mark shifted in the bed, his voice quieter than before. "I guess I should say, thanks." The words felt heavy but honest. He wasn't the type to admit when he was wrong, but today had changed something in him. Dr. Reynolds nodded, no hint of arrogance in his face, just a quiet understanding. "I didn't save you because of your beliefs. And I wouldn't have refused to, even if you had left." He gave a small, knowing smile. That's what being a doctor means. Mark let that sink in. For the first time in a long time, he didn't have a comeback, no argument to make. He just nodded. As the doctor turned to leave, Mark hesitated. "Hey, Doc." Dr. Reynolds paused. Mark cleared his throat. "Maybe. I don't have everything figured out yet." Dr. Reynolds gave a small nod. "None of us do." The door closed behind him, leaving Mark alone with his thoughts. The pain was still there, but something else had shifted. Maybe trust wasn't about agreeing with everything. Maybe it was about knowing when to let go and accept help, even from the last person you expected.